Welcome to this week's Leading with Purpose. This week we've got a slightly different guest. Often we're talking to people from the world of business, but today we're talking to Kindra Hyttner. She's Director of Communications and Engagement at the NHS Trust that supports and looks after mental health right the way across Kent and Medway. A really important but ultimately different part of how we support social mobility. Kindra, thanks so much for being part of the podcast today. And we'll get into a lot more about what the Trust does in local communities and working with businesses as well, increasingly. But perhaps let's start off by tell us a little bit about your journey into this role and in the sense what drives you on this whole agenda of not just mental health and what you do day to day, but that bigger footprint of supporting social mobility.
Yeah, thanks. And hi, Justine. Nice to be here. Well, I guess my role has always, my career has always been in communications, but I think from a really, really young age, I had always had this kind of desire for, and I guess just ambition around serving the public and that real kind of public service need. So even when I was in school, volunteering, helping out in like local communities, I was from quite a working class background. I was the first one on both sides of my families to go to university, which was a huge thing for me growing up and for my parents as well. And I guess, my career has just really been about that public service. And I found a real deep sense of purpose, in particular in healthcare. I think from a communications perspective and leading teams and organisations to communicate effectively with the public, make sure that we're really transparent about the information that we're sharing and have that duty to be open. I'm my absolute best when I believe in what an organisation stands for. And I can't think of anything more kind of purpose-led than the NHS, but also mental health in particular. When I grew up, my dad was very, very unwell mentally. He was sectioned a number of times, and it was absolutely horrific as a child to experience that. I mean, as a family, but as a child to see someone who is there, who's meant to be your kind of protector in the world, who's meant to be there to kind of care for you, look after you, not even want to be on this world, is just devastating. And so when I saw the role, in my trust now come up, it was just a no-brainer. I had to go for it. Obviously delighted to be here 4 years in, and delighted to really be driving forward our work on kind of social value, because you sort of mentioned there in the introduction about, private organisations, and obviously there's a real drive, isn't there, for globally and internationally to be much more aware of kind of sustainability and those kind of developmental goals. But actually in the public sector, we have so many opportunities because we're so connected to our communities. We're so in touch with people across the areas that we serve, that is absolutely the right thing for us to do, to go above and beyond that service that we deliver as kind of our bread and butter. And so, yeah, it really drives me, and our sort of work that we've been doing with the Purpose Coalition in particular is really exciting because it's taking us into new areas that we hadn't, kind of forged before. But yeah, I just think we're doing a lot, but there's so much more we can do as well. So I feel like we're at the start of our journey. But yeah, it's a really exciting time for the trust, and I'm just really pleased we're an organisation that takes it seriously and wants to do more.
And it is exciting. And I think partly it's because, certainly, I mean, we're very proud to have you part of the Purpose Coalition. We've got a lot of employees and businesses who are part of it, who can be part of the solution on social mobility, but including mental health. And actually, who in many respects are almost that front line of public health delivery. And if an employer thinks in a particular way positively about the role it can play on protecting and maintaining mental health of its employees, then, keeping those lives on track is a big part of how your NHS Trust actually supports delivery of strong mental health services. So I think those relationships and partnerships work really well. But as you say, I mean, I think it's amazing to share your background and your own experiences. I think it really helps people understand why this is personally so important to you. And I think it also gets across about the prevalence of mental health challenges for people. There was a time when we didn't really perhaps talk or understand about mental health challenges that people face. I think now there's much more of an ability to be just very open about the fact that people have physical health challenges, they have mental health challenges, and it takes that wider NHS to respond to it. But I guess for Kent and Medway in particular, it's a really diverse set of communities, some urban, some rural. So maybe tell us a little bit about how you see this agenda in terms of serving such a different population in different parts of the region that you look after.
Yeah, no, and it's a great question, and it's a real challenge, I think, for us. So we are the only trust covering that whole breadth of the county, and as you say, really, really diverse, geographically spread county with, real pockets of kind of privilege, but then pockets of extreme deprivation, poverty, and then what comes with that, is higher levels of suicide in certain pockets of our communities. So the approach that we're trying to take is really kind of map that information against kind of all the great data that's out there already around public health, but really kind of understand the disparities then in our services themselves. So we're actively now kind of mapping our data, trying to record a bit more proactively, without trying to give our staff too much to do, but start, recording some of that data around ethnicity, for instance, and just so that we can start to kind of track some of our patients and then see if there are disparities in our services. We have, for instance, a research team, and they're fairly new and they're doing some brilliant stuff. So they've been working with universities locally in Kent and Medway, the Kent and Medway Medical School as well, to go out into very hard to reach communities across Kent and Medway to start having that conversation about mental health, because it's prevalent everywhere actually, and that stigma is prevalent everywhere, and that's something that I'm really keen as a trust we address going forward. And I mean, one of the things that we found out through that is the Nepalese community, for instance, in Kent, they actually don't even recognize dementia. So they have no kind of shared language or understanding of how to communicate and talk about dementia. Now, straight away, you've then got a barrier to kind of access an assessment, then the support that comes with that. So kind of real challenges there, because that's the kind of information, really kind of taking it back to basics of explaining to these communities what it means. And then on the flip side, you might have other communities that do really know about mental health, but then feel that there's a huge stigma around accessing services and not wanting to access services. So, we're trying to take a very kind of targeted approach across our county, starting with getting that data right, looking at opportunities to kind of partner locally, because there's the private sector, but there's also the third sector. I mean, mental health and people's well-being couldn't exist without the support of our third sector and charities as well. They do some brilliant work. We've been partnering with them on our community approach actually to transform how we deliver community care, and they can offer services that we can't, and actually that's what we should be doing, is creating a kind of holistic approach for people that kind of meets their individual needs and pulls on the best experts at the right time. So that might be us sometimes, it might be the third sector, but giving people that individualized care to suit them. Yeah, I mean, I could talk to you for hours about this, but there's so much that we're doing, but as I say, so much more that we can be doing, and teaming up with other NHS organisations as well. Some of our partners, our community partners, we're really keen to address, do much more around prevention. Obviously that's been a big part of the government and the NHS 10-year plan. We want to think about how can we get out into our communities, do physical and mental health checks together. We absolutely should be doing that side by side. Lots of opportunities to do more and really give that kind of individualized care support to people who need it.
And going back to, oh, I think that's spot on. And going back to some of those underserved communities, if not those natural touch points with the NHS, there are natural touch points with other groups, whether it's in the third sector, whether it's social prescribing, perhaps through social services, through housing. I think it's, as you say, Kindra, it's that ecosystem, isn't it? Building the ecosystem of support and then making sure it kind of is targeted to the places where perhaps we feel people are less aware of it. Or as you say, maybe there's a stigma in all of this. And I guess part of that is, a really simple but important thing, which is people just understanding that you focus on mental health and that's what your bit of the NHS Trust does.
Yeah, absolutely. And it's quite timely sort of mentioning that, because we've just had approval fairly recently to change our trust name. So we will formally be called the Kent and Medway Mental Health NHS Trust. And the reason that we're doing that, it's more than a name change. This is about that clarity of who we are, what we do, and also what we stand for. So, the stuff that we're talking here around kind of, our purpose, goals, and what we want to do to help our communities. So We did a huge piece of engagement with our communities about a year ago now. The biggest piece that we've ever done, about 740 hours of listening to patients, families, partners, our staff, to really get a sense of what do people think of us? What do they think of our services? And what came out loud and clear from that is that there's so much confusion. I think the NHS is a very complex system, and I think what a lot of people don't understand is that we're almost run like individual businesses. So we have our own executive team, which I'm part of, with our own board that we're accountable to, and then we have our integrated care boards, and then you have the regional NHS team, and then you have the central. It's very complicated. And for the public, they just want to go and get the right care at the right time in the right place. But when it comes to mental health in particular, oh my goodness, do we overcomplicate it even more than we need to? And I just think that basic being able to explain to people what the journey is, what they can expect from us. And it came right down to simple things like our name. So at the moment, our name doesn't reflect who we are or what we do. And we want to be really proud of the fact that we are the Mental Health Trust for our county. We're going to be taking on children's services as well. So at the moment, they're delivered by our partner outside of county. And for some time, we've been really keen to bring all of those services together under one organisation. And it's the first time in history that adult and children's services will be delivered by one provider in Kent and Medway. So you think about those young children, we need to be really simple about explaining our name and who we are to them, to their families. And then that goes all the way through to like the language that we use. So my team, fabulous. They're doing a huge piece of work at the moment around how do we make our communications more accessible? How do we really kind of simplify the language? I mean, there's so much more that we can do to make our services accessible physically, but also then through the communications and kind of the words that we choose to use and describe ourselves, particularly for people who, when they come to us, are at their most vulnerable time in their lives.
Yeah, and I think if you're going to crowd in more volunteering from people, if you're going to crowd in, for example, purpose coalition businesses like Southeastern Railways, who for them, mental health is a real issue for their operations, for passengers, of course. And, often some of those mental health situations play out for them on the railways, and their staff are dealing with people with mental health conditions. I think it just needs to be really obvious where
Yeah.
within the NHS to match up with that existing expertise. And I also think maybe there's a bit of a legacy, isn't there, Kindra, around, for a long time, people thought of the NHS as really physical health. And there was a piece of it that was around mental health. But actually, maybe all that's happened is over the last 10, 20 years in particular, the mental health piece has become more understood, more distinct, has its own standing almost in a way that is much more a core part of the NHS, and therefore it's now sensible, frankly, to be clear about what we're talking about. Is it mental health? Is it a wider NHS? And people actually do need to understand where different bits of this huge labyrinth style NHS organisation they can get their support. It's not obvious, is it? And I think you're so right that as ever, it's a bit like in the corporate world, there's all this language that's used and people who are in that world completely understand it. But for the rest of us who are outside, it feels quite formal, doesn't it, at times? And you're like, oh, maybe this is not even clear that sometimes it's an NHS sort of patient facing bit of the organisation. You're like, oh, maybe this is an executive body. And so I think clarity probably does matter. And I guess bringing the discussion into the internal side of things. I guess it matters for your staff and their development, and it's probably worth touching on how that can now percolate back into what you'll be able to do within the NHS Trust for people.
Yeah, absolutely. Well, I guess on the staff point in particular, I mean, we've had overwhelming support to change our name. And I think, if you came and spent some time, and I know Anne came and spent some time on some of our wards and was talking to staff, there's a lot of staff that will have similar stories to me of their personal experiences. So I feel like there's a lot of people in our trust with real personal connections to mental health and wanting to make that difference. That's what gets them out of bed. But it's tough, right? It's a really tough environment across the NHS, and especially so in mental health as well. I'm in awe of our staff, but we need to make sure that we look after them and look after our own. So we've done a huge amount of work around kind of health and well-being of staff. Following COVID, we had a service that we ran county-wide to all of our partners, and we were going out to visit them with our clinical teams to offer them support, an opportunity to have kind of psychological interventions if they need it, someone to talk to, because it was a really, really difficult time, and continue to be. And I think we haven't come out of that. So we're still seeing, high levels of sickness and people feeling, just really kind of tired. And we just want to do everything we can to sort of look after them. So that service had wound down, but actually we're restarting that again at the moment. And we're hoping that we can take that back out kind of county-wide as well, to just sort of offer staff that. Because I think when things go wrong in mental health, they go really wrong. And that's, of course, really traumatic for patients, their families, but it's also so traumatic for our staff. And we just need to make sure we kind of, give them the kind of support that they need as well to kind of navigate some of those complex challenges that they're just facing on a daily basis.
A lot of this is about changing the culture, the leadership from the top, and if you like, setting the right context for people to be successful in and supporting them. And it's probably worth digging into, in practice, you talked about some of that support now. What about the staff development piece? I know you've done a health and wellbeing academy. Is that part of how you see the trust really enabling people to develop their careers once they're part of the team?
Yeah, absolutely. So we've got, various different development routes, and we're very fortunate that we've got a brilliant kind of organizational development team that have got kind of real focus on that. So one of the things we're doing at the moment is a big leadership program to kind of look at our leaders, because a lot of the time you'll have leaders in the NHS that have become professionals in their skills.
Yeah.
As a clinician, or it could be me, I'm an expert in communications. So just making sure we're giving people those leadership development opportunities there.
All
So we're
that they
it,
need.
exactly. So we've got a big focus around our kind of leaders at the moment. And also on the culture piece, I mean, the identity work that my team has been driving forward, that really is to almost, we're using the name change and our identity as a reset for our culture, because we know we've got challenges. We know we're not perfect. We know there are opportunities where we can do better. And every day we should be striving to do better. But I think and this is my first NHS role, but I think when you're working in an environment where things can go wrong, and when they go wrong, that's bad. It does create naturally that kind of, I guess, that fear. And what we want to make sure is that people don't live in fear, that people come to work, that they do their best. And if things go wrong, that there'll be the support there, but also that we'll learn from it, and that we'll learn together and take that forward in a really kind of psychologically safe way. And I guess one of the things that I try and bring to the role, and my exec colleagues kind of, we're on the same page on this, is just doing things differently. Yes, we can learn from other NHS organisations, but we can also learn from the private sector. I worked in the private sector for government services, for government departments. There's so much learning that we can bring to the NHS, and I think that's where we need to think about doing things differently. When Anne came and launched our Purpose Coalition report. Yes, when Anne Milton came and launched our Purpose Coalition report to staff, I mean, it was one of the most well-attended staff events that I've led in the 4 years that I've been here, which straight away shows this matters to our staff and our people. And some of the suggestions that they were coming up was about how can we break down some of those barriers to enter into the NHS, because you have these kind of frameworks of like, you have to be degree educated to get at this level, or you have to have a master's for this, or equivalent experience, and it can become quite vague. And so some of the suggestions there were, can we be a bit more inclusive, can we do it differently? And so I've just set up a new team that's very focused on involving and engaging our communities and our patients and improving our services. And so I had said to the head, just go and do it completely differently. Let's go do it in the community. Let's take a very different approach, do it with HR, set side by side. And we've done that. So and that might seem simple to, if any of your listeners are from the private sector, might think, well, we do all this all the time. But for the NHS and for us as a trust, that's new and that's different. And actually, we've had so much diversity then in the people that we've now recruited that are going to come and work for us, because we've removed some of those barriers to entry. And so I think it's things like that we need to be thinking about more proactively, and doing more as well.
And I think part of it is just that because we all use the NHS, and so our engagement generally is with the doctor, the nurse, if you like, the medics who are part of it. And yet, as an organization, it's got this whole group of a wider employee base to keep the show on the road. And one of the things we've been doing through things like the Purpose Lab, where we bring together our employers in the Purpose Coalition with the students, is to start, encouraging the students to realize that actually there's a whole world of roles. I'm a finance person, I'm an accountant, and I ended up working in healthcare. I worked in pharmaceuticals, but it genuinely didn't cross my mind to go and work and do my finance stuff at the NHS. And yet, a bit like you, I wanted to do something that I felt was worth it, that had a sense of purpose.
Mm.
And I don't think it would have taken much of a conversation to make me think, oh, actually, yeah, I hadn't really thought about that. And I think for so many other people in communities, we use the NHS, but we don't think about working for it. And yet, actually, it's just got some incredibly rewarding, yes, at times very challenging, but ultimately crucial and rewarding careers, that are probably out there. And you don't have to be a medic to be part of them. There's a whole range of opportunities for people to make a difference through working in the NHS. And, like you say, at a time when that talent can be hugely valued by everyone, frankly. But I guess it must be a real time of change, and it must be incredible to literally see the organization shifting day by day, month by month, looking at how it can improve its processes, its outcomes, and seeing that have an impact in a wider community, Kindra.
Yeah, and I think you're right. It's that there's so much opportunity in the NHS. You can go and work in estates, or you can be a housekeeper. And actually, when I look at some of our housekeepers and the role that they play on our wards, they're having conversations with patients. They're building those connections. That's all part of the care package, isn't it? It's not just the clinical teams. It's everyone that kind of keeps the show on the road, so to speak. So yeah, there's lots and lots of opportunities. And I think it's about, feeling like you get to the end of the day and feel like you've made a difference, and just each day kind of one step at a time, improving what we do. It is really challenging. There's a lot of change happening, as kind of nationally, and that's, feeding down regionally. And a lot of that is to address some of the bureaucracy and some of the things that just get in the way of delivering the best possible care. But it's constant change. So back to your point around kind of staff and supporting them, it's really important that we support staff through that, because the NHS has never stayed still. It's evolved since its inception, and every kind of year there's a new challenge or new things that kind of present itself. So I guess we have to kind of build that resilience as well in our organizations, to be constantly thinking about what can we do. AI is a big example of that. Lots of trusts are starting to adopt it. We're exploring some pilots at the moment, but there's huge potential there, for us to use AI even in, our communications, to make our communications more accessible, but also into kind of improving some of our systems and processes and things. Yeah, there's a lot to do still in that area, particularly in mental health, where it probably has been, I guess, had not as much focus as maybe some of the acutes and the physical health historically.
And I guess that's part of, when you have your sense of where this goes in the future, that vision of what the trust can be. It is that more inclusive version of the trust that's, reaching into bits of communities that at the moment are harder to get to. But I guess, yeah, there's that tech enabled piece of it as well, isn't there?
Yeah, and our new ambition is about helping our communities live well.
Mhm.
And so yes, we've got the kind of core services that do that, but it's that broader piece. And we are unique in Kent and Medway because we cover such a broad base, but also a lot of our patients are people that might be with us for a long time. So unlike, say, if you were a cancer patient, you'd have your kind of, if all going well, you would have your sort of treatment, and then you would go into kind of remission, and then you would be discharged. For us, sometimes we have people with us for a longer time, so we have an opportunity to build relationships there with them, with their carers, with their loved ones, and that enables us to be really connected to our communities as well. So huge potential there for us to really listen to and work together with our communities. I mean, where I would like us to be is that we have people come knocking on our doors to say, actually, can you do this? We need a service to do this. Can you give that to us? Or can we work together to do that? That's, I almost kind of shift that power into the communities, into the patients, away from that kind of top down, this is the service and can you help us? I would much rather we kind of flipped it on its head and got to a place where our communities are driving those changes for us.
Well, it's been brilliant having you on the podcast, and thanks for the impact within the Purpose Coalition for us as well. I think you're really challenging and getting all of our businesses to think a lot more proactively about where they fit into the solution on mental health. So I think there's definitely a sort of knock-on effect of all of our working that we're doing together, but a really positive one for NHSs wherever our Purpose Coalition employers are as well. So Kindra Hyttner, thanks for being part of the podcast today. It's just been brilliant to get a whistle-stop tour around Kent and Medway mental health and the NHS services supporting it. So it's really appreciated. It's a busy time for you, I know. Thank you.
Oh, you're welcome. Thanks for having me.